This conversation is powered by Google Illuminate. Check out illuminate.google.com for more. Welcome to the discussion. Today we're diving into a fascinating paper exploring how learning and using multiple languages physically changes the brain. It's all about structural plasticity in bilingual brains.
The brain's ability to adapt is truly remarkable, and nowhere is this more evident than in bilingual individuals.
Exactly. The research shows surprising variability in the observed changes. Some studies show increases in brain volume, others decreases. What accounts for this inconsistency?
That's the key question, and the paper proposes a compelling answer. It's all about the individual's language experience.
So it's not just a simple bilingual versus monolingual comparison?
Not at all. The quality and quality of language learning and switching are crucial.
Let's start with the basics. The paper emphasizes experience-dependent brain plasticity. Can you explain what that means?
It means the brain structure isn't fixed. It changes in response to learning and experience. Think of taxi drivers with large hippocampi due to navigational skills, or jugglers with altered motor and visual cortexes. These are structural adaptations driven by experience.
And this applies to higher cognitive functions like language?
Absolutely. Even vocabulary size in a native language correlates with the volume of language-related brain regions. The key is continuous practice. If a skill is abandoned, the brain often reverts to its baseline structure.
The paper mentions the Dispansion partial renormalization hypothesis, or EPH. Can you elaborate on that?
The EPH suggests that learning a new skill initially leads to an increase in dendritic spines, creating more neural pathways. Then, a pruning process occurs, eliminating less efficient connections, leaving only the most effective ones. This explains local gray matter changes.
And what about white matter changes?
White matter changes, often seen as alterations in diffutivity, are likely related to myelination. Increased myelination improves signal conduction speed and synchronization, reflecting the need for efficient connectivity. Once a skill is mastered, the need for this enhanced myelination may increase.
So how does this apply to bilingualism? The paper reviews a lot of studies with varying results.
The diverse findings become clearer when viewed through the lens of experience. The amount and type of language exposure significantly influence the observed structural changes.
Can you give some examples?
Certainly. Longitudinal studies, where individuals are scanned before and after language training, show gray matter increases in language-related regions like the supramarginal gyrus, inferior frontal gyrus, and anterior cingulate cortex. White matter integrity also improves, indicated by decreased diffutivity in connecting tracks. However, if training stops, these changes often reverse.
How do cross-sectional studies comparing bilinguals and monolinguals at a single time point fit into this picture?
Cross-sectional studies often show similar patterns to longitudinal studies, but with less consistency. This is likely because they don't capture the dynamic nature of brain changes over time. The experience of the bilinguals in these studies varies greatly.
So the age of acquisition, AOA, of a second language plays a role?
Yes, AOA often correlates with the magnitude of structural changes. Earlier AOA is sometimes associated with smaller differences between bilinguals and monolinguals. This suggests that the timing of language exposure is a significant factor.
The paper also distinguishes between simultaneous and sequential bilinguals. What's the difference in their brain structures?
Simultaneous bilinguals who learn languages concurrently often show subcortical and cerebellar changes, while sequential bilinguals who learn a second language later tend to show more cortical changes initially. This difference likely reflects the different language learning and switching experiences.
And what about immersed sequential bilinguals?
Immersed sequential bilinguals, those who live in an environment where they use their second language extensively, show patterns more similar to simultaneous bilinguals with subcortical and white matter changes. This highlights the importance of immersion.
What about bilingualism across the lifespan? How does it affect children and older adults?
In children, simultaneous bilingualism is associated with increased white matter integrity. In older adults, lifelong bilingualism is linked to better preserved white matter and sometimes increased gray matter volume in certain regions, potentially offering neuroprotection against age-related decline.
And what about bilingualism and neurodegenerative diseases?
Studies on patients with MCI or Alzheimer's disease show that even with worse brain preservation, bilinguals often perform better on cognitive tests, suggesting more efficient use of remaining brain tissue. This points to a cognitive reserve effect.
The paper also examines interpreters. How do their brains differ?
Interpreters, with their extreme language switching demands, show a unique pattern. Some studies report reduced gray matter volume in certain regions, interpreted as increased efficiency. However, initial training often shows increases, suggesting a dynamic process.
What about bimodal bilingualism involving both spoken and signed languages?
The research on bimodal bilingualism is still limited, but it suggests some parallels with unimodal bilingualism. Increased white matter volume in certain areas has been reported, possibly reflecting enhanced cross-modal integration.
The paper proposes the Dynamic Restructuring Model, DRM. What are its key features?
The DRM is a three-stage model. Stage 1, initial exposure, involves cortical gray matter changes related to vocabulary acquisition and language control. Stage 2, consolidation, shows a shift towards subcortical and cerebellar changes related to language control and efficient connectivity. Stage 3, peak efficiency, is less well understood, but may involve further refinement of language control mechanisms.
How does the DRM relate to other models of bilingual brain plasticity?
The DRM integrates and expands upon existing models by explicitly incorporating the time course and experience-dependent nature of brain adaptations. It's compatible with models emphasizing the role of linguistic environment and genetic factors.
What are the next steps in this research?
More longitudinal studies are needed, especially those without linguistic training, to better understand the time course of changes. Analyzing language experience factors within bilingual groups can also provide valuable insights. Furthermore, we need to investigate the biological basis of these adaptations using advanced neuroimaging techniques.
What techniques would you suggest?
Techniques like NODDI, which measures neurite density, and MRS, which measures brain metabolites, can provide more detailed information about cellular-level changes. Combining structural and functional data with behavioral measures will give a more complete picture.
The paper mentions some studies looking at biological correlates. What have those revealed?
Studies using PEAT and MRS have shown correlations between bilingualism and changes in brain metabolism and metabolite levels, suggesting cellular-level adaptations as a compensatory mechanism. These findings support the idea that the observed structural changes have a biological basis.
So these changes aren't just random fluctuations.
No, they're adaptive responses to the demands of learning and using multiple languages.
So in essence, the paper argues that bilingualism is a dynamic, lifelong process of brain restructuring shaped by individual language experiences.
Precisely. The DRM provides a framework for understanding the variability in previous findings and highlights the importance of considering individual language experiences.
And this has implications for understanding cognitive reserve and neuroprotection in aging.
Absolutely. The more we understand the dynamic interplay between language experience and brain structure, the better we can understand the cognitive benefits of bilingualism and potentially develop interventions to enhance cognitive function.
That was a great discussion. Thank you for your insights.